So what this session is really set up, we have some framing questions that I gave the panelists in advance, and what I want to do is to have each of them kind of give an overview, like a 5-minute overview in response to these framing questions. And here are the questions. What are examples of community engagement approaches that have worked to address environmental injustice and environmental disparities in the region, outside of the region? What are examples of community-based partnerships that have had a positive impact in addressing EJ disparities in the region and outside the region? What are best practices in community engagement, CBPR, and CU partnerships from your work that will be useful in the region? What are some challenges and barriers to authentic, transformative, and effective CBPR partnerships in your work? What are some lessons learned that may be useful for community capacity building and empowerment in communities impacted by EJ and health inequalities? And what are some of those next steps for different groups that you think about, next steps for groups, academic partners, fellow partners to move the agenda forward in the region? So I will start with Dr. Hinkle.
All right, Chicago. Well, thank you very much for organizing this. This is really great for me to be here. I am relatively new to this area. I've been on the faculty at Johns Hopkins in the School of Public Health for a little bit over a year now. But I come from North Carolina, and I did my training there with Jacoby, actually. I was 2 years behind him all throughout school, so you can imagine what that's like being in the shadow. But, you know, Jacoby and I, when we were in North Carolina, and my comments, since I'm so new here, are going to be sort of through the lens of North Carolina and some of the work that we did there, but I think there's some lessons there, best practices and challenges that translate, just like we heard from Bernice Miller-Travis, some of these are resources. So, one of the first things that I got involved with was through the statewide North Carolina Environmental Justice Network in North Carolina. So, the story that we heard at lunch is sort of around the time in 1991 when there was this really, there was a robust state, U.S.-wide environmental justice movement. And over time, some of that has kind of broken apart, and for many reasons, the life of some of the statewide networks has kind of taken a different form. But North Carolina has this great history, statewide environmental justice network, where it really is a model in terms of thinking about the issues in different communities, and what the EJ Network tries to do is to be a resource, to connect academia to different community issues. And just to give you an example, so some organizations have quarterly meetings, and they'll have them where they are. So the Statewide Environmental Justice Network holds their quarterly meetings based upon if the community calls them and says, hey, we have this issue. The EJ Network will go to that community and be hosted by that community and hold their environmental justice quarterly network meeting there to try and bring attention, media, and a lot of resources to the issues. So in North Carolina, at the University of North Carolina at Chapel Hill, a state-funded, for the people, by the people university, there's a landfill to which the university has historically been sending all of its trash. All the local towns in the county around the university, Orange County, it's the regional landfill for the area. And there's a community that sits right next to the landfill. And can anyone guess the demographics of that community? Majority African American, majority lower wealth. And for 40 years now, this community's been speaking out at the local level, just like we've heard from Bernice Miller-Travis, about their concerns related to these issues. So over the years, they've had some successes in sort of fighting the expansion of the local solid waste facilities, and some failures. And so what the community did around the time that I was in school with Jacoby there, they placed a call to the North Carolina Environmental Justice Network. So when they called the EJ Network said, we're going to try and host our next quarterly meeting in the Rogers Road community and hear about your issues and try to bring attention and resources to people there. So that brought me to the community. Some of the strategies that Jacoby and I have been working on after we heard the issues: water pollution, air pollution, odor, trash, vermin, a lot of the same concerns that you hear in other environmental justice communities. We started to think of strategies and thinking about scientific, policy, and organizing. So it's really those areas to try and connect measurements that we could do with mapping, geography, GIS, sociology, doing qualitative interviews, environmental sciences to make quantitative measurements of water and air quality, and also epidemiology to see where we can connect some of the environmental measurements and health. So through this process, this was about 2007 when we got called in. We sat down with the community around the issue of the landfill, and around all these issues, one of the first discussions we had was, what can we do right now? Not wait on a grant, see if we get funded, go down those steps. What can we do right now? So we sat down and we said, let's get a lay of the land of the demographics. Let's get a lay of the land of what existing records there are about lack of compliance with the existing local, state, and federal laws on the books. If we can show a disproportionate adverse impact, we can tie it to Title VI, like Bernice Miller-Travis was talking about. We can tie it to Clinton's Executive Order 12898 on environmental justice. And then all of our work that we've done since 2007 has been to try and collect data in a systematic way to support kind of the existing records that we can find. And with the community, we actually sat down and got people who really had to get a sense for how serious it would be if they were to file a Title VI administrative complaint. They all agreed it was worth the risks in terms of intimidation or pushback that we could get. And then all of the work that we did issues. What came out of these, this session, the principles of community engagement, community-driven is the word that I like, because all of our work as scientists was to support the Title VI administration, to try and build the scientific evidence around that. And so, I provide that story of the Rogers Road community and landfill is one example. We've done that in other areas around stormwater discharges, which I think could be very important in this area, with some of the work we heard in the session around Baltimore and Anacostia. Another trick is that, and I'll close here after this, but Title VI depends on federal money being spent. You used to be able to show that those federal dollars have a disproportionate or adverse impact based on one of the Title VI groups. Well, it's tricky now as federal money is starting to dry up or run out, or we're looking forward, and private money is starting to fill some of the holes, and some of the industries that create environmental injustice. Here may be private entities. In North Carolina, it's the industrial, transnational food animal production operations, the hog and poultry industry. So we have to think creatively about Title VI, but also in areas that you heard Bernice Miller-Travis talk about. Some of the community engagement strategies in building the science, we're starting to talk about International Human Rights Declaration, like violations of human rights, to try and really raise attention around it and build science behind it in a way that could elevate the profile of some of our work to try and get some of the basic compliance with existing laws in place.
Hi, I'm Suzanne Randolph. I'm a retired associate professor from the university here, and I now work at a federal contractor that assists community organizations and the federal government in doing community-based participatory research. In my role at the university, I serve as the community engagement liaison for the university's Prevention Research Center under CBPR. The examples I'm going to talk about are from my work in both arenas. Some of our community members are present here in the audience. One is the Ward 8 Drug-Free Coalition. It's a community coalition, and though it's focused on drugs, these are universal approaches. The same communities are affected. If we put I've seen in Baltimore, you hear from my colleagues here, what they call the butterfly pattern, where all the dumping, all the toxic, all the licenses for fast food restaurants are all in this butterfly pattern. So though I might study obesity and substance abuse and somebody else is specifically studying environmental health, we see the same data over and over. The other is from Port Towns Community Health Partnership, which is in an area here inside what we call the Beltway. Many of you might be local, and so the interstate Beltway that wraps around DC and the nearby Virginia and Maryland communities. Incorporates this university, which is in the county that I'm going to talk about, but it also incorporates many other communities. Prince George's County has been named or designated sometimes the most affluent black county in America. Yet, despite that, it has these environmental injustices, health disparities, and so forth. And then, thirdly, we work in the area of HIV with the university because we are in a jurisdiction that crosses borders, Virginia, Maryland, and Virginia. We also have to figure out how to address some of these disparities because it's not just sitting in one local community or 4-block area. There are people who work and live and play and worship in these areas. And we have something called a Metro map, the subway map. I don't know how many people have seen that. But the subway, orange, blue, green, red lines that run through these areas. DC, at least when this was taken, had an average life expectancy of 72 years. The area to the north, which is more where the federal government agencies like National Institutes of Health Campus and so forth sits, had an average life expectancy of 80.1 years. To the west of DC in Northern Virginia going out to Dulles Airport, a life expectancy of 80.3 years. And to the south going toward Reagan Airport and a little further down, 80.9 years. And Prince George's County, 75 years. So the most affluent black county in the United States, which sits in the midst of all these resources, has still a life expectancy much like DC 72 years, which had a high concentration, particularly in Ward 7 and 8, Dr. Green and her colleagues are here, that has been impoverished, affected, and so forth, much like the community. And I think that dump sits over there too, because when you're on the highway, you have the smell that reaches out at you. I live in Greenbelt, Maryland now. I taught at the university for 20 years, but I lived in Fairfax County. And when I saw the Metro map a few years ago, I was like, ooh, good, 80.9 years, you know. So, but I've moved now. I've now moved to Greenbelt, Maryland, and I saw 75 years, and so some of my motivation is really tied to that and other communities, and I live inside the Beltway as well. So when I was invited to be on the panel, I'm talking about lots of different examples, but they're all kind of lessons learned. As an academic partner, I did a lot of research in the community, and I used a lot of what I call the community-based participatory research principles. How many people here know or have used CBPR? It's referred to. Raise your hands, and if not, I'll help you out just a little bit. Okay. So just a little bit. Everything that he said, I say, these women will say is CBPR, because these lessons are in here. We've just, as academics, taken the opportunity to frame them. So there are about 8 or 9 principles, and you can Google CBPR and it'll pop up. I was on my phone, I apologize, but I had a PowerPoint presentation before he told us we didn't need one. So I'll be happy to post these with you, and you can look on his website and so forth, Dr. Wilson's website and so forth. But basically, I'm going to go through it really quickly, and then you'll hear the lessons learned as you're talking here. So collaboration and equitable in all phases of the research. You're just not collaborating. You're an equal partner, whether you're the university or the community. And what happens a lot of times with community engagement and CBPR approaches, even the federal government funds CBPR, but sometimes they want CBPR approaches, not CBPR research. So it's incumbent upon everybody who gets invited to the table to know these principles, so you can know how to play, because people will ask you to write letters of support, letters of intent, and then you get no money. You might not even get called when the research gets there. But if it's really CBPR, you might have a community engagement coordinator or organization like these young people here. You might have, I'm a community liaison, engagement liaison, because I don't want to work full time with you. But you might find yourself in that role. I've volunteered for nonprofits. I've lived in Virginia and Maryland and worked in DC, so I know communities and I know how to enter and exit. So you want to be able to identify who's at the table, who should be sitting at the table, and then do you have the right people at the table? So in that sense, that you can have an equitable process. In Port Towns Community Health Partnership, we have lots of different sectors, and they're focused on healthy eating, active living. So we have farmers, and as well as the grocers, the people who own the grocery store and lease it out to the giant and the shoppers and so forth. You need the community to be the unit of identity. The community, not your organization, not the university. So when we're out running around disseminating, we need a name that says partnership. So in Seat Pleasant, it's the Seat Pleasant University of Maryland Health Partnership. And we refer to it as that. In other places, like the Ward 8 Drug Free Coalition and other places, it's about the community. People know we're talking about Ward 8, which is a community in DC that borders Prince George's County. You have to build on the strengths and resources of the community. We often go in documenting needs and the need to change. But we need to also document the policy system and environmental change strategies that have already happened or in place upon which we can build. And CDC has something called the Change to Action Guide, which some of your colleagues probably developed down in North Carolina. That is a real useful tool for understanding how to do that. You need to know that this is a co-learning process and capacity building for everybody. My role oftentimes is to do cultural competency trainings. Though I know CBPR, I know research, I do research, I often just start with cultural competency. Even as an African American going into an African American community. There are things I need to know and understand that I don't. So I have a co-facilitator who helps me negotiate that. In terms of what you focus on problems that are local concern. Oftentimes, a university has entered these communities because they have that target population. Not because there's the environmental health hazard sitting there, but because they have some other demographic, what we refer to as those social determinants of those health outcomes. They're poor, they're densely housed, they're poorly educated, the schools are in a mess, or whatever that checklist of things are. But again, you have to then flip and say, well, what are the assets here as well? There are people who graduated from those same schools. There are people who come from other communities to teach in those same schools. So we have to take the whole picture into account. And I use the concept of learning community, that we're both a learning community as well as a community of practice. So we're learning from each other about what will work, won't, and so forth. You have to balance research and action. I want my research, I need my publications because I want to get my tenure, I want to keep my good government job, or whatever the reason might be as a researcher. But the community is also saying, I want something, but don't go asking just for money. There are other things that universities and academic partners can bring to the table for you. That technical assistance and training that you needed in your school, your church, or place of worship. They have people who can help you do things that will help your other organizations as well as individuals. Come and do health fairs and blood pressure checks and all of that kind of stuff in addition. But it has to be to the mutual benefit of everybody. And then finally, I think, not of the principles, there might be one or two others, but dissemination and reporting. As I said, reports to researchers mean we have to have a rigorous methodology, and we use some frameworks that have CBPR and respect that. But when you do reports, you have to do, I call it a dissemination matrix at the outset. You have to say down on the far left-hand side in a column, who are all the people I need to report to? And sometimes it's the people who you collected the data from or with. Sometimes it's your board of directors, the university, the students, whatever that list is. And then across the columns, you have other columns that are saying in what format and for how often and so forth. So I need a different kind of report. For Ward 8 Drug-Free Community Coalition, I use community briefs. You do graphics showing them what the youth drug use is like and whether it's going down in their community. For the Port Towns people, they need information about how the youth are changing their healthy eating and active living behavior. I have to do youth surveys, but they don't want to see what I'm going to present or publish at a professional meeting, so I have to boil that down to a 2 or 3 page document. And then for the HIV prevention work, we work collaboratively with the health department and the Sexually Transmitted Infectious Disease Coalition to work out where we disseminate, to whom we disseminate, and who is going to be reporting. So sometimes I'm not even there. It's a community member who's presenting on these data. So I tried to incorporate a lot of these questions or answers to these questions in just going over the principles so that everybody's kind of playing, at least starting on the same page. Don't read a lot into it, but there are some specifics about what CBPR is.
All right. Well, I felt like I was in a learning mode. But it's just so, I'm sorry, I'm Kat Tracy, and I am the Community Engagement Coordinator in Baltimore City, and I also serve on the Environmental Justice Partnership Board, which is a community group that came together as a research project. In Baltimore, what was happening, we work for Hopkins, the community is around Hopkins, and there's this love-hate relationship with the community and the university.
Some people in this room know Hopkins.
Yeah. So with that said, you know, what we do with that Environmental Justice Partnership Group, we came together as, like I said, a research project, so that there is this bi-directional communication with the researchers and the communities. So that's what we hear all the time. The researchers want the community at the table after the grant is written, and there are not a line item on that grant. They haven't even heard what the community is interested in. So this community group was formed, and the first project that we worked on was around demolition. So I put some little handouts for you just to show what we worked on. But I want to finish with about the community group. So from 2003 into 2007, we were a research project, but because the community group that came together was so intent on continuing the work that they were doing and the relationship that had developed with the Hopkins researchers, that we became a 501c3 organization. So we still exist today on our own without having to go under the guidelines of the grant. So we're happy about that. And like I said, we started the project out around demolition. In Baltimore City, we have thousands of vacant properties. And what was happening, they were taking them down as emergency activities. So you will wake up, there was nothing for you to wake up and find all this equipment in your neighborhood, in low-income neighborhoods. This didn't happen in what we call Beverly Hills. We have a Beverly Hills community. It didn't happen there, but it happened in the lower-income neighborhoods. And they would wake up with all this heavy equipment, and at the time, they were taking down these properties with wrecking balls. So you can imagine the noise, the dust, and if they had the wrong address. So that was, it raised, a big flag to community groups. It's like, okay, what's going on here? And so what we did with that group was, we decided, okay, first of all, people don't listen to you like Brittany said. If you don't have the science, you can't prove that demolition emits all kind of junk, mainly lead, into your neighborhood. So the science was completed first. So we did the science. We went to community where demolition was being scheduled, and what we did was we decided to do some focus groups. We walked around, we talked to the residents, and we asked them, what are your concerns about this demolition that's going on? So first of all, you have to listen to people. You have to understand what it is that they want help with. We say don't come with a preset of what it is that you're going to do for that community. Find out what it is that they want to do. So that's what we did with the demolition project. We listened to them. We interacted with them on as much as we could, and then we had the forums, and we asked them, if we had to put this in kind of a product to give to the residents, what would it look like? So they helped us. They helped us to design every page of this booklet, and I'll show you in a minute. And we put it together, and and the other thing we talked about is who should be at the table. So we looked at, okay, well, who's conducting this mess? So the city had the set of specs that existed. But when you looked at it, it was so much garbage, as someone actually call it. Because no one agency could go to the page and say, these are all the things that we're supposed to do. It was all commingled into this one document. And even when we looked at it, we had to sit back for about a month and say, where do we start with this mess? So what we did was we picked out each agency that was responsible or that was listed. So we listed all of what that agency was supposed to do. And then we went back to that agency and we said, is this what you're supposed to be doing? And it was like, oh yeah. It kind of dawned on them. They never looked at this thing. So we did that. We got city agencies, we got residents. We felt like we wanted to have, if we're talking about health impacts, we should have a health organization at the table. So we did that. So we kind of made a list of what's going on here, and let's bring people together. And our table kept growing and growing because every time we would make a presentation, we would realize there was somebody else missing from that table. So we learned a lot, from having those conversations and having those people at the table. And like I said, out of all of that, bringing people together, we developed a product that the residents asked for and wanted, And also, the nurse organization that was at the table